healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
My name is Mark Reibold. If this is your first time listening, I'm the host of Coffee with Coker. And today's episode, we have a relatively new team member of the Coker Group. Actually, he's been here since the beginning of 2019, but definitely a veteran of the healthcare industry. So we're really happy to have Richard Romero here joining us, not only at Coker, but today for the podcast. And we had a great discussion. Richard is experienced in a lot of different things as it relates to healthcare consulting. He does a lot of work in healthcare evaluation and physician comp work, but he's also become Coker's point person on the overall topic of telehealth. And we have a number of people that contribute to covering this topic, but as it has grown and become more prominent in so much of what's going on in the industry, Richard has really kind of taken on a role of running point. And so that's what we talked about today is telehealth. And really what we wanted to do is tee up the topic from more of a big picture perspective. We've actually talked about telehealth in other episodes, but this was kind of an opportunity for us to introduce Richard and allow him to specifically tee up some of the bigger picture topics and issues and discussion points as it relates to telehealth and telemedicine. And in the future, we'll be generating a lot more content on this topic. So please stay tuned, follow Coker's social media and via our email blast so you can kind of stay up to speed on that information. With that, I just wanted to also mention a quick housekeeping note. As we were recording this episode with Richard, there was a little bit of construction going on in our office, so there may be a little bit of background noise. We hope that didn't disrupt the audio too much where it takes away from the discussion, but I don't think it did. As always, we want to encourage you all to subscribe to the podcast. You can listen to this episode and all of our episodes directly on our website. You can access all of them at coffeewithcoker.com. You can also get them from all the different podcast subscription services. And you can also stay tuned on social media, LinkedIn and Twitter for updates and announcements on new episodes. But with that, we hope you enjoy this discussion with Richard Romero talking about telehealth. We are here with Richard Romero, and this is the first time, Richard, we've had you on Coffee with Coker, so welcome.
Thank you very much.
Before we dive into the discussion, maybe just give us the quick background, your background, the quick overview of kind of where you come from, since you're still a relatively new member of the Coker team, and I want to give you a chance to talk about some of your experience and focus areas.
Excellent. Well, I appreciate that. I've been in healthcare for about a little over 20 years. A majority of that has been spent in the areas of valuation. Also done quite a bit of work in serving expert witness testimony. And then along the way, some kind of unique consulting projects. And so I think telemedicine is what we're going to be talking about today, is kind of a unique blend that takes into account operational, financial, and quite frankly, the biggest question that exists right now in that space is what's the value of telemedicine?
Sure.
Which for what I do in most of the services I provide is a very operative question.
Yeah, well, that's well said, and you teed it up well because you're absolutely right. We're talking about telehealth, and this is such a broad topic. Honestly, I mean, there's so much to it, and obviously, much more than what we can bite off in one podcast. And we are seeing more and more happening in the realm of telehealth, and Coker is doing more and more work related to telehealth. And so this is something we're covering. Richard is for everyone listening is really Coker's guy spearheading this realm, if you will. And it ties to everything we do. And so it's important for us to have the right subject matter expertise and leadership around something as big as this and is happening with such big impact in the marketplace, and we'll continue to do so. But we thought it'd be good to just at least take some broad strokes in covering the issue, where we're at, what is it, where we're at in the evolution of this issue now. Maybe look ahead and in our crystal ball a little bit and try to interpret a little bit of what can be expected, because I know this is something on the mind of many of our clients and those that we interact with in the market. So as we talk about this, let's just start out. I mean, what are we talking about when we talk about telehealth?
Mark, it's really interesting. Every time you have a conversation about telehealth, there's this initial need in some ways to try and define it. And I think in almost every conversation that need exists because it is so broad that it's hard to define and get your hands around it. The way I look at it, kind of defining telemedicine, telehealth, this virtual care world that we're talking about is really anytime care is given to a patient and the doctor and who or I should say provider, and who that provider is talking to are not in the same physical location. It may be the most broadest sense for what's transpiring, but that just speaks to the breadth of the applications of technology.
And even though we're talking about it as something that's really emerging, it's not new. I mean, this concept has been around for some time, and there's a tremendous degree of technology that today I think is becoming such the norm outside of healthcare that it's not surprising to see it trickle into healthcare, and it's only going to continue to grow. What are some of the things as we think about where we're at today, though, in that evolution, and some of the hot topic items as it relates to telehealth?
Well, I think, and you could go in a myriad of directions with that, but I think that the single biggest question is, should I be doing telehealth? How should I be doing telehealth? How do I get paid for telehealth? Is this really, how do I assess my return on the investment for this? What kind of technology do I need to have? What kind of risks does that introduction of that technology bring? Are the patients really going to adapt to this modality of care? And we see some studies, we think about millennials being more attracted to technology. What we're actually seeing now is in some ways that the senior population absolutely has adopted and becoming more comfortable. And then there's all of the limitations. We think about it in more urban markets of, not only do we have Wi-Fi everywhere, but we have gig speed Wi-Fi, where in a number of rural markets, internet actually still doesn't exist.
Absolutely.
And so how do we leverage what these providers can actually bring to markets that are in dire need of it?
Yeah. And to your point, and again, I mentioned this in the intro, but, we will be covering many of these and more kind of these sub areas of this overall topic, because you're absolutely right. There's so many different directions we could take it, and there's so many different questions that need to be answered. I think before we get to the why do I need it, or how, and how do I make it reasonable, how do I make a case for it? Let's talk a bit about, we can't do anything in the healthcare world without Washington's involvement to some degree. So maybe let's tackle this, at least where we're at today. And I know you've monitored this a lot, and that's why I want you to talk about it, but where we're at from a policy standpoint as it relates to telehealth.
Mark, again, another great question. And I think even before we get to policy is, take the temperature of those making the policy, if you will. And I think, at least from my personal view and my recent trip there, I think what we really see are those that are truly dedicated and understand the issue. Everything from access to building the infrastructure, taking internet to places so that could be a next step, to those that are very well into the weeds with regard to reimbursement, CBO scoring. But overall, I think there is a general increase in understanding the fact that this will allow the government to follow through on its access to care, especially in rural markets. But they're taking a cautious approach in that, as we know, as we've seen in healthcare, every time we make a change, there's always seems to be unintended or unthought through consequences. So they want to make sure that we do this in the correct way.
Sure.
Overall, I think the issue is it's clear that the benefits that telemedicine or telehealth can provide, but they want to do that in a very thoughtful manner.
As we think about the influence of policy and the role Washington plays as far as things like this happening. They certainly don't happen overnight, but as you think about this evolution and what's driving it, you alluded to the rural, I don't know if we want to call it rural challenges or whatever it may be, but I'm a firm believer that the challenges that rural health organizations face, they can be pretty daunting. And I like thinking anything that can be a potential solution for them and get the positives and hopefully avoid the negatives. Do you see us going in that direction as it relates to telehealth? And I guess the second part of that question is, do you think the policy coming out of Washington and even at the state level is facilitating that to help rural health organizations?
Yeah, so there's two parts, and I think that's what we're saying is I think there's a natural mesh between those two. So if we look at just a quick overview of policy out of Washington, we've seen an expansion of Medicare allowable codes, clearly recognizing that the modality of care is something that they want to clearly incentivize because of the benefits that they're recognizing, both in terms of putting the patient in a comfortable position, providing the right level of care, the right resources where they can access it.
So you're saying the policymakers are updating the coding protocols to better allow for remote health services virtually?
Absolutely. So we've seen that in some of the remote patient monitoring codes.
Yeah.
But a challenge still remains on the policy side is the 1834 limitations with regard to originating site of service. They were still trying to identify some of on the claim forms, basic questions like when we're saying the address of the provider, is it literally where the provider was when he provided the service or where the provider normally provides service? So some of those basic questions still hadn't been answered until very recently. So I think that there is a recognition on the part of Washington that this is going to provide access to care and reduce costs to the system in a number of ways, and it extends the knowledge and care of providers to markets. On the rural side, Mark obviously do quite a bit of work in that space, but from a pure distress perspective in terms of financially, we're seeing a number of bankruptcies that are occurring in the rural markets. Not only does that, with the economic impact that a closure of facilities have in that local community, we now have an issue of care.
Yeah.
How far do those patients actually have to travel to actually get, and sometimes basic care, in more severe circumstances, life-saving care from that perspective? So the development of different technologies that can take former hospitals and put them into urgent care centers, standalone ED, put a helicopter pad on top for those types of more emergency type situations. So what you're able to do through the use of telemedicine is allow for bringing care to markets that would otherwise be in a complete dearth.
Yeah, we've seen, I don't know, I can't put my finger on what the number is today, but, a record amount of discontinuing OB care in rural health settings. And so, you think about remote patient monitoring in that case, and then additional access for higher levels of acuity. It's something that I feel like the technology is there. The value could be there for the organization, for the providers, because to your point, even if they're not facing closure or bankruptcy, the reality is, in the high likelihood, they're at least struggling from a financial standpoint. So is this a solution that could be there for them, for those organizations to overcome some of these challenges?
Yeah, Mark, absolutely. And I think, the other part of that is just from a financial return perspective. And I think one of the great things about telemedicine is it combines both of those, in that if I can keep a patient in my local hospital and I'm not having to transfer my patient 30, 40, sometimes even greater distances for care, but through a telemedicine application, I can reach out and have the guidance of a specialist where I'm able to keep there. And quite frankly, in some ways, confirming that I don't need to transfer the patient out saves everyone time, better for the patient. They're there in their home community. We all know they do better when we like to be close to home when we're sick, foundationally, but that also allows for right care at the right place and allows for the patient to ultimately have better care.
Well, I think you could even say the other way as well. Sometimes it's better to keep them out of the hospital. So if there's a way, a methodology, a system in place, I've seen this and I've heard this come up with step-down care. When you have kind of a post-acute setting, maybe a long-term acute care setting, just sending a patient back to the ED is not always the best answer, but in many cases, it's just the only alternative that's available. Could there be another way to provide that higher level of care that, frankly, they're probably not even going to get in the ED, but that's just the step they have to go through to get back into the chain of the system. Is there a way to address that?
Mark, I just wanted to say that I think you're absolutely right in talking to, director of telemedicine for a hospital system. she expressed some frustration, quite frankly, that if I could have had a virtual visit with this individual, this 10-minute physician-patient interface, I could have kept this individual from coming to the hospital, incurring the ambulance charges related to that.
Yeah.
We would have saved a ton of money, would have been better for the patient all along. And so that's a simple example in terms of where some of the originating site limitations cause problems. And there's, I think, some low-hanging fruit with those applications. Hospice in some ways as well. So these opportunities where visits could be avoided in totality and the patients are actually getting care and not having to be transported. So that raises a neat question that one of the other things that we're seeing is when you have, these virtual visits. And so you wonder about the depersonalization of the provider-patient relationship. And what we're finding and what's coming back is that once, especially on kind of employer-sponsored care where they're having these, that they have circumstances where you can take the next available provider, go into a queue, or you can wait until the provider that you had a previous conversation with is available. What they're finding is increasingly that level of communication and trust is being established, and patients are actually waiting because, that's my doctor, just happens to be on my computer.
Yeah.
And so it goes to the consistency of care and that relationship of trust and care. Ultimately, it just happens to be through a different modality.
Yeah.
But that's my doctor.
Yep.
People are associating with my doctor. This happens to be on my computer screen.
Absolutely. Which, I mean, just at a basic level, I think, and you made this point earlier, it's not just young people that are getting used to that. This is something that grandparents FaceTiming with their grandkids is a very normal thing. Why could you not have that same dynamic for a routine visit that would keep me out of the ED where I don't need to be in the first place?
Absolutely, Mark. And I think, you tie that in with what we're seeing is wearables and other devices. And I think in terms of, to use this as a jumping off point to talk briefly about telemedicine adoption, you have those that are perhaps still sitting, do I do this? What do I need to do? I'm not sure what to do. There are those that have been doing it a while and they've got it. They stay up to speed with things. And then there are those, the next stage is, I've got this. What else can I do with this technology? And so you have some in the especially in the academic and nonprofit world that they're actually taking the cost of, I'm going to send out a package, which is a blood pressure cuff and a cheap scale to record those daily items. And after surgeries with chronic conditions, they're able to, based on some numbers and in some instances just answer a few email questions, they're able to regulate medication to keep people out of the hospital.
Yep.
And so that's some of these basic things that we all kind of hear about. From that level all the way to a surgery going on in Baghdad that was guided by a physician at Walter Reed Hospital.
Sure.
And it's amazing what's transpiring.
Yeah, absolutely. And I think the technology is there, but let's talk for a second on the technology piece here, because again, I think it's interaction, the social interaction via technology, whether it's video or text, is obviously extremely common now. What are when we think about telehealth from a IT standpoint, if you will, maybe give us some broad strokes on what are some of the kind of things to think about? What are some of the things we're going to probably have to be addressing here in the near future as it relates to this?
Well, I'm going to go, as we started out, and say that is incredibly broad.
Yeah.
Everything from text-only applications connecting physicians to patients to essentially pods where a patient can go in, hold on to a couple of sensors and have all kinds of readings taken from that perspective. But no matter the technology, one of the biggest issues that you have is we're now talking cyber. And every time you're talking about cyber, you're talking about threats and you're talking about security
and information.
Information, right? Mm-hmm. Inherently, you are collecting PHI in its most base sense.
Sure.
So a big key in any kind of technology, and it's a very thoughtful process because you may have an immediate need for, I want to do behavioral health visits. What else am I going to be able to use that cart for? Mm-hmm. Which raises a fundamental question of, do I need a cart? We see some technology where cameras are going right into EHRs. Well, that kind of cart doesn't fit well in the back of an ambulance. And are there technologies specific to that? The answer to that question is yes. I think, though, that all of them have the commonality, again, of the security. So it's critically important that those that are providing telemedicine are doing a true risk analysis, which is separate from a gap analysis. Those can get confused.
Sure.
A gap analysis is to a standard. A risk analysis is really trying to figure out where am I at risk for penetration and issues. And as you look through and are looking at the technology solution, not only do you have to think through that risk assessment, but also contracting. What are the terms? How am I going to use this? What training do I need to have for my people? So I think that's it's a great modality and means to provide care, but that's going to, from the infrastructure perspective, from the IT guidance, but also we are seeing in some of the medical schools actually classes that are being talked about in terms of developing what I'm referring to as a webside manner versus just the bedside manner. Yep. So it's not only the modality, but the way that you're interacting with patients. Yep. So long-winded way of saying most important thing is to assess as whatever, after you decide what you want to do through thoughtful application, guidance, thinking about the implications of that on your providers, make sure you understand what your risks are, because those can either be something that you can sleep well at night about, or perhaps be your biggest risk area.
Yeah. I like that. The website, I hadn't heard that, but the website versus the bedside, I think, that's only going to become probably more commonplace. And I think you're absolutely right talking about the risk assessment there, because, and we've talked about this, and we'll make sure these links are available in the show notes. Ross Cordini, who is one of our team members, talked about a little bit of this as it relates to the coding, but the security from a compliance standpoint. We also talked about it in a couple of episodes where we're talking more about the technology piece here, specifically cybersecurity, and it's kind of opening up this new realm. But one of the points that was made is that, the reality is telehealth does not really introduce a whole lot of new concerns as it relates to cybersecurity. We already have those. You can be in the same health system and you go from the inpatient setting to the outpatient setting across the street, and you still have those cybersecurity issues that you're going to have to deal with. So it's not that that telehealth in general presents any overarching cybersecurity concern, but it truly is. I think you said it well in terms of identifying where do we need this, where is this going to really be implemented, and what are we trying to do with it, and then we can talk about the specific security applications of that context.
Absolutely. It's not creating the risks or the risk. It's what's the flavor of those risks, because they exist in daily operations in healthcare entities, on a daily
and they're not
basis.
going away.
We've got data. Those are going to stick around as long as we have data.
Yeah, that's right.
Mark, you mentioned a key piece about in terms of coding and other pieces on compliance. I think a significant trend that we are seeing is increasing levels of compliance within the telemedicine space. I think the white paper that we had kind of addressed a couple of significant issues there, but the general theme of is in the past, rightly or wrongly, whether this was considered this way, there's a sense now that the level of compliance expectations on the telemedicine side of the business are going to be the same or increasing to the same level as those as the standard brick and mortar. So that's an area, obviously, to think about and go forward.
Kind of a new mindset that's required to wrap your head around that. This has been extremely helpful. Before we wrap up, though, I want to make sure to give you the opportunity. Is there anything in terms of kind of coming up from whether it's a policy perspective or kind of what's coming down the pipe and just general marketplace that we kind of our audience should be looking out for on this topic? I mean, any sort of, major policy events coming up or to be expected or that we're pushing for or against or anything like that?
Yeah, I think from a policy perspective, FTC just recently announced a $100 million investment to provide greater access for basically infrastructure to allow for web in rural markets. So again, the focus rural markets or the expansion, which clearly indicates that, hey, this is a good thing. We need to make sure we have access there. A couple of dates that are coming up, key on SUD or substance use disorders, in terms of allowance or expansion of services there. We have in October coming out, supposed to get some direction on implications for under the Ryan Hyde Act for prescription drugs. And then in January, should be very interesting, that can have a lot of implications, is the allowance for telemedicine as a core benefit under M&A plans, which may help scoring in terms of the CBO, in terms of looking at, because they like Medicare data, what will we have more data then to say, here's some of the benefits with regard to telehealth.
Well, that'll be interesting to look out for those. And something tells me there's probably more to come after that. I mean, down the road too. So
we still have the Connect Act that's out there. And that's probably the single biggest piece of potential legislation that folks should probably stay on top of.
Okay. And then finally, last thing I want to mention, you kind of going back to your background and specific areas of expertise. I know a common question is, how does telehealth connect to the whole realm of value, whether it's physician comp or however value is interpreted? And I know this is a broad topic. We'll spend more time, probably have a whole episode just on this alone, but maybe just give us, again, the high level perspective on where is this topic of telehealth relevant? How is it relevant to comp and valuing services?
I think, and when we talk about value, I think value is a couple of different ways. So I'm going to take a little liberty of that. Please. And that is within the entities themselves, there is, as you're rolling out a telemedicine platform, you've got to get, your physician or provider champions that are on board to do this. That's going to take political capital. Yeah. And anytime you're expending capital in whatever form, there's risk associated. Sure. And value is that balance between benefit and risk. Yeah. So you've got to consider that. And so to have a better story, it's determining what your financial return is going to be. And generally, they're going to be looked at as two things. How does this increase revenue, or how does this reduce costs? Yep. And so looking at both of those. And as you're thinking about that from the implications, for example, on the providers who are ultimately the ones that are providing guidance, whether that be to patients or to interprofessional consultations, whatever the case may be, how is that going to impact them? Is this going to cannibalize their services that they would otherwise provide? Mm-hmm. What does that do for their cost structure? And quite frankly, some of the physician compensation plans that are out there really are not designed to handle this kind of these kind of technologies. And so,
if it's going to erode their basic compensation formula by participating in these things, then it's never going to get off the ground. You can't just expect everybody to be on board just out of sheer support for conceptually.
I think, and I think taking a little liberty with what you say, I think if you really want them to take it seriously, I think inherently doctors may say, well, this was a good thing, but this is going to kill me. Then it's time to kind of relook at that compensation plan and say, okay, here's the way we can recognize you for what you're doing. Again, we've seen that going back to what we talked about at the beginning with the policy in terms of Medicare recognizing additional reimbursement for services, but it's thinking through of how they're practicing, what the burdens are for that, and making sure they're compensated fairly. But that's a process in and of itself to get the stakeholders involved to think through that.
Yeah, which to me sounds like the first step. I mean, as long as you're having that conversation and you're intentional about making that an important element of this overall effort in your organization, then I think you're going to get that buy-in early on, because I think it is something that everyone in theory can benefit from, but all these different pieces have to fit.
Yeah, to kind of close out, what I would say is for telemedicine is, what is the problem that you want to solve? What is it going to do to either my revenues or my costs? To actually execute on this strategy, what do I need to do from an IT perspective in terms of selection, the risks that we've talking about from that perspective, make sure that we're compared on the compliance side as we're executing on that strategy. And then how do we make sure that the providers are fairly compensated given this new dynamic? So there's a mixture of a number of things where the execution of a telemedicine strategy just needs to be thought through completely.
Yeah. I think that's well said, and I think that brings it full circle. And so I appreciate you again, there's so much here to even think about, much less start to digest on this topic. So I'm glad we have the opportunity to kind of tee it up. And as a teaser for everyone listening, this is something that we're going to talk more about, and we're going to drill down into some of these more specific areas and different, variables to consider and try to dig a little bit deeper as far as what they really mean and what we're seeing out there that's taking place today. So that'll be interesting. But I appreciate you giving us a high level overview, and we'll look forward to talking more about this in the future.
Terrific.
Thanks.